Good morning, everyone, and welcome to CEDA's live stream on reimagining the Australian care economy. My name's Cassandra Winzar, and I'm a senior economist at CEDA, the Committee for Economic Development of Australia. CEDA acknowledges that today and every day we're on Aboriginal land. Committed to recognition and reconciliation, we respect elders and we support their stated aspirations. Today, I'm coming to you from Perth, on the land of the Whadjuk people of the Noongar Nation, and I'd like to pay my respects to their elders, past, present, and emerging. We encourage you to join in today's conversation by following CEDA on Twitter at CEDA_news and tagging any comments on today's discussion with the hashtag #CareEconomy. You can also participate directly in today's discussion by asking questions using the Pigeonhole app. You can enter via the live stream page or log in via ceda.pigeonhole.at with the password #CareEconomy. On Pigeonhole, you can either enter your own questions or also view and vote on the questions of others, so I know which ones are the most important to today's audience. At the end of the event, we also ask that you rate your experience in Pigeonhole. You can start popping your questions in Pigeonhole now. The work that CEDA does is only possible through the incredible support of our members. And to that end, I would like to acknowledge the sponsor of today's live stream, Trobe University, and thank them for their ongoing support and making this event possible. The care economy has been an ongoing area of research for CEDA for some time now. And in particular, we've released a number of reports on how to improve and expand the aged care workforce. The care economy is critical to improving the lives of all Australians. It is often not given the attention it deserves. Spending on all aspects of care is often viewed as a drain on budgets, yet it should really be viewed as crucial economic activity and social infrastructure. The care economy is broad and includes early childhood education, disability, health, and aged care, amongst other things. These are often seen as individual sectors in their own right and tend to operate independently. But there is more and more overlap between sectors and workforces, and there is a strong case to be made for broader industry collaboration and policy coordination. The care economy is facing many challenges, and today you'll hear about issues with workforce, with wages, with funding, and policy issues. But what you will also hear today is discussion on how we can improve things going forward and how the industry can work better together to solve some of the challenges ahead. Joining me today are three experts to answer all your care economy questions. We have Dr. David Hayward, Emeritus Professor of Public Policy and the Social Economy at RMIT. We have the Honourable Bronwyn Pike, AM, CEO of Uniting Vic.Tas, and Professor Irene Blackberry, Chair and Director of the John Richard Centre for Rural Ageing Research at La Trobe University. Each of our panellists are going to give some brief introductory comments, and then we'll have a facilitated conversation. So please start putting your questions in Pigeonhole now to prepare for the Q&A section. I'd now like to invite David to make his opening comments, and he'll then pass on to Bronwyn and then Irene. Over to you, David.
Thank you very much, Cassandra, and thank you everybody for being here today. I've got two takeaways for you. One is to do with the care economy as a concept, and the other one is to do with productivity and how that relates to the care economy. So the the care economy bit is that term that we're using, it hasn't just been plucked off the dictionary production line. We're choosing it consciously and deliberately. It's meant to indicate a shift in narrative and understanding. We want all of that work that Cassandra mentioned before, from early childhood education and care to disability to aged care to family violence, mental health, and so on. I want it to be understood not as about welfare and consumption as a cost, but something more about economies, about industries, about prosperity. It's a really important shift, because the other thing that concept of the care economy does, instead of us seeing silos of those areas that I've just talked about, we see one big economy, and it's a secret to future prosperity. So the first point, care economy matters. The term matters. Remember that term. That's the first point. Second takeaway is productivity. When I talk about productivity, I know the very first thing that'll come into your mind, he's talking about dollars. I'm not talking about dollars. It's not just about the cash, right? In fact, often, as I'm sure Bronwyn will be able to illustrate, if you cut cash, if you cut the spending, what happens is productivity declines. It doesn't increase. You might have fewer workers. You might have workers who've got less time to spend with the people they're caring for. So cutting cash is not the same thing as lifting productivity. Maybe productivity in your mind conjures a different sense. Technology. Prometheus, the wonderful idea of technology. Well, yes, it's a little bit about technology, but it's technology in a certain context. The technology matters only to the extent it improves that relationship between caregiver and recipient. Always understand it in that context. And that brings me to the heart of the matter, which is that for productivity to be understood and for to be a productivity revolution, we have to focus our spotlight, our interest and our attention on that really important, highly complex, highly skilled relationship between caregiver and care receiver. We need to enable, we need better education and training. We need people to be able to move from one sector to another so that they can bring their skill set from early childhood education into family violence or aged care or disability and move all around the system. We need new qualifications that are built on micro-credentials so people can pick up new qualifications. They can do nutrition, they can do physiology, they can do public policy, and most importantly, ethics in whole new combinations that we haven't thought about before. Because if we do that, the care that's delivered will be fantastic. People won't end up in highly costly institutional settings. We'll be keeping them out of those settings. They will have better, happier lives, and not just them, but their loved ones, the people who care for them. So the secret to productivity lift is the quality of that care relationship, and that's what we have to do. Now, if we achieve those two things, if we achieve the two things, care economy, one big new economy, productivity thought of as part of it, what I think we're going to find is that in the same way in the last century, productivity revolution and manufacturing delivered a massive improvement in living standards. This century offers us a wonderful opportunity to be thinking about a productivity revolution in care that lifts living standards even more than what we saw in the last century. That's a wonderful opportunity, and it's far too good to miss out on. And with that, I'll happily pass over to Bronwyn.
Thanks very much, David. And hi, everyone. It's great to be with you for this really important conversation, which, of course, David has just kicked off. I've worked in the health and human services sector for about 35 years. I've experienced it as a consumer, a policy advocate, a teacher, a government minister in all the relevant portfolios, a board chair, and a CEO of a fairly big provider. At Uniting Vic.Tas, where we are now, I have 4,000 staff in 20 different professional groups covered by 12 enterprise agreements and 16 awards. And we have about 2,000 volunteers, and we support hundreds and thousands of men and women and children in 15 different service streams and around 700 separate programs, each one with its own accreditation, its own regulation, its own acquittal, and its own service delivery requirements. We make a really big difference in the lives of many very needy people in our community, but we could just be doing a whole lot better, utilising those precious resources more productively to achieve greater efficiency in the work we do and more sustainable outcomes for families and for our consumers themselves. And David's talked a little bit about that. If you're a single mother escaping family violence and you come to one of our sites all over Victoria or Tasmania, it's highly likely that you've been in contact with our agency before. You may have been nudged around the early learning or the child protection or the alcohol and other drugs or the mental health or the financial counselling or the homeless support or the material aid programs, just to name a few of ours or other agencies already. And if not, you may need some specialist services in the future. The trouble is that those services don't line up, and they each have their long and separate individual waiting lists. So this is clearly incredibly frustrating for consumers, just as it's frustrating for anybody who's experienced the highly siloed and unintegrated healthcare system. But that's just one problem. And David talked about productivity. It's also highly costly for the taxpayer who support all of these services. About 80% of our funding comes from the government, and many costly supports and intervention programs have high levels of recidivism because the ongoing support doesn't seamlessly line up. And so when one thing falls off, people's lives can fall over like a pack of cards. And so that very costly intervention may in fact not have been as effective as it could have been. Whilst a hospital system may triage a person who prevents, they are eventually treated in that location. It's not perfect, but at least they're not referred all over the place to multiple separate service providers and programs, some of which, of course, have been developed in haste by governments who often feel compelled to respond to the next unfolding crisis, or maybe the outcomes of a royal commission, by announcing new programs with a whole new set of reporting requirements. And that's a bit like the Sarah Lee approach, which we find is characterising this service system, just layer upon layer upon layer. Workers also in the sector are often trained in narrow and very highly specialised roles where, in fact, there is a huge overlap, and areas like long-term case management, which is really what is required, have many of the same skills that some of these separate disciplines have. So when I think about complexity and desperate needs for things to line up, I'm actually drawn to one of these things, which we've probably all got at home, the Rubik's Cube. Now, when the Rubik's Cube came to the market in 1974, they started to have these official races to see who could click it and get the bits to line up. The first competition they had, it took 22.95 seconds for the fastest collating of this thing, fixing of this puzzle. The latest competition they had, it took 3.47 seconds. The possible combinations, there's lots of different theories, but the one I looked at said that there were 48 sextillions. That's 21 zeros after the 48 of permutations and combinations to get all these colours to line up. But, you know, humans have proved, and that reducing in time frame, that we can solve very big and complex issues. And I'm sure that working in the care economy and getting things to line up more effectively is not beyond us. And I'll hand over to Irene.
So thank you, Bronwyn. That's a great, I guess, illustration on, you know, not only how complex the care economy is, but also, you know, that we are in crisis. So agree with what David has illustrated earlier, that, you know, we do need to act now. So I guess the current, questions that facing us is that, you know, well, how are we going to address this? Where are we going to start? You know, it's just, you know, too hard really to do. So three key, I guess, areas that I would like to outline, you know, and share with you today. Obviously, one is around leadership. Second is around innovation. And third is around investment. So let's start with leadership. So leadership needs to come from the top. So late last year, the Commonwealth government has released a national strategy to achieve gender equality, and a discussion paper around care economy. A new task force is then set up to release the first ever national strategy on care and support economy by mid this year. So it's great to see that, there's a leadership from the Albanese government to address the challenges that we experience in the care sector. However, the national strategic policy and leadership alone is not enough. We do need to have a much more holistic approach to tackle this crisis. And we certainly need to broaden our perspective that this is not just a women's work issues. Gender equality alone is a great approach to care economy, but we really need to think it broader, and we do need certainly to think outside the box. We need to think about, how we can bring all the stakeholders together. As Bronwyn outlined, this is not just a single provider's issue, and certainly this is not a single silo care sector issues. So there are a lot of people and there are a lot of actors, involved in this. And that's even before, we talk about, the person-centered care, the person, requiring care and requiring a very complex care needs, and how we can actually deliver and meet the needs of the person over their lifespan. So we need innovation to do that, and we also need investment. When we review the current evidence, it is clear that there are evidence do exist in individual care sectors, but very little research is done to integrate the care economy as one system, and how together we can solve many challenges that we come across in the sector. So if I can have the slide, please. We did an extensive consultation with our industry partners at Trobe since 2020. We did use the Delphi methodology to enable us to find out a bit more about, some of the pain points, but also to understand better about, how we can actually solve the problems together. So La Trobe University now proposes 3 pillars towards an integrated approach to care economy. The first one is we will launch a flagship care economy research institute to conduct interdisciplinary research across La Trobe University. We have 5 research domains around care technology, workforce, delivery, experience, and the economic, social, and policy. The second part is about the Cooperative Research Center bid on care economy. And as you can see in there, we have gathered a very strong interest and commitment from industry partners to undertake industry-led research projects. And this is where, when we see the leadership, it does not need to come all the way from the top. We do need to have leadership from every level to come together to address these issues, the challenges that we're facing now. There are 3 main research program areas that we propose for the CRC. The first one is around care technology. Second one is around the care workforce. And the third one is around care delivery. And as David mentioned earlier, we do need to have a strong education and training program. And this is critical because in the care economy, the workforce is the key point that will make a difference. We can adopt technology, but we can't leave behind the workforce and the people, the consumers, the end users. We need to bring all of them together in this journey to address the challenges that we are facing now. And lastly, the part, I guess, that will bring this together is the Care Economy Collaborative Network that will support both not only the research institute and the research, that we do, but also to support the networking of the industries, of the individuals and organizations across the care economy sectors to network, to share ideas, and to collaborate in future research projects to deliver a better return on the investment. So innovation is critical, but obviously, money is needed, to actually change, to make a difference. So investment in innovation will really need to occur before we can actually make a difference, in people's life. So on that note, I will hand over back to you, Cassandra.
Fantastic. Thank you, Irene, and thank you to all our speakers for their opening comments. We are starting to get some questions through on Pigeonhole, but please keep popping them in and voting on the ones that you want. You've got a little bit of a flavour for who our speakers are today from their opening comments, so it should give you some good ideas for questions. What I'd like to start with, and David, I'll start with you on this, but certainly keen for input from anyone, is we've talked a bit about this technology, this innovation. What does that look like in a care setting? Because we often people hear about technology in aged care and they think of, robots or things that are taking away from that human experience. But how actually do we see technology in a role that actually adds to the human experience and allows for more of that face-to-face care, not less?
I think, thank you, Cassandra. That's a very good question. But I would encourage people to think of the technology solution in two senses. One is the more that we can use it to shift resources from back office to front office, the better. So at the moment, as Bronwyn talked about, the formidable regulatory and funding burden that she faces with so many streams to have to be accountable to, all those resources that are wasted. Just home care at the moment is an example. I think the Grattan Institute has highlighted that something like a quarter to a third of the money goes on administration. We've got to shift that to the actual care delivery point, the relationship between the caregiver and the care receiver. And the second bit around technology is to enable those caregivers working with care receivers to work out what technological solution would work for them. The human bit, touch, is crucial. It can't be avoided. We want to celebrate that. We want that to happen in a safe and progressive way. So think of it as enabling that care relationship to be more effective and enduring. Don't let people take over that personal side of it. That's crucial, because that's where the complex judgments come in that we should be celebrating. So that would be my answer to that question.
I'm happy to give a couple of quick examples. I think that when David was referring to the back of house areas, you say, well, why don't you just get a CRM that will cover your whole organisation? And we try and do that in an environment where there are not a lot of resources. But the compliance means that, in fact, we have to upload a lot of consumer information straight into compliance portals. So it's not. So that's why it's a partnership between the funder and the organisation to simplify the way in which we can hold consumer data. But the other thing that David did talk about was the ways in which, in a sensitive and careful way, we can in fact assist people that we're caring for. Now, you can't shower a person who's in a home care program over the internet. But what you can do is maybe replace some of the visits that are made for medication management or wound management just by the use of technology, or by dignifying the process so that consumers can in fact make their own appointments online and organise their own weeks. With things like route optimization technology, you can actually schedule appointments much more effectively so that people aren't waiting around for caregivers to arrive and they can get on with the other things in their day. So both areas have huge opportunities for productivity, but better caregiving as well for consumers.
I think, Irene, you also have an argument around this about co-design, the importance of bringing people together to make those decisions rather than being imposed on them. This might be a good point to pick up on that side of what Bronwyn's just raised.
Yes, so that's right, David. I mean, obviously, there are a lot of innovations around. I think that, what we need is really to tailor the innovations, tailor the technology so that it is fit for purpose. I know that, there are some concerns about, we can't just replace, all of the care work, with technology, and that is true. There is a recent research, review to show that, probably only about 39 to 40% of the care work can be automated or can be done by the technology over the next 10 years. But really, we still need the human to actually do the care side of it that, Bronwyn mentioned. So we do need to combine both, but I think we need to bring both the workforce, to be a digitally enabled workforce to make it happen.
Thank you. Look, I'd like to stay on that thread and pick up on that last comment you made, Irene, about making sure you've got the digitally enabled workforce. It is often a sector that is viewed as one that doesn't necessarily have strong digital skills. Is that something that we do really need to invest more in? And how do we kind of do that to upskill the workforce to make sure they can actually make the most of any of these opportunities that are coming their way? Irene, I'll start with you, but keen for other comments.
I think the co-designing of the technology is very important, Cassandra, because, obviously it needs to be user-friendly. And, we need to start, right from the beginning when we actually co-designed a solution so that, we can actually scale up and actually reduce the time, to uptake. But, this is not just about for the workforce. I think the consumers, the end users, will also need to learn how to use the technology. So education and training, obviously, it's important. So this is not only a formal education, but also, for the workforce, we are talking about professional development opportunities like micro-credentialing, for example, and short courses, but also involving the whole of community so that the consumers and the carers are not actually being left behind in this digital transformation in the care economy.
And Bronwyn, you've got a large workforce. What are you doing to kind of make sure that your workers are skilled and up there with all the digital technology and things they might need to know there?
Well, I do think obviously training is important, and the development of apps and things like that are user friendly. But I also don't think I think sometimes we overestimate the kind of training that's required. And I remember when banks first started bringing in online banking, and there was a huge hue and cry, oh my God, they're going to close all the branches. Oh, we can't go in and we can't, tell me one person on this call that wants to walk into a bank now and ask a teller to move money from their credit card account to their savings account or the other way around. We are very adept at picking up innovation, and I think it's putting the tools in people's hands, as Irene said, that they've had a say in developing, and people will make that adaptation. I mean, I think the trouble with the care economy is that we're so far behind what people have taken now for granted in the other transactional parts of their life, in online shopping, in travel, and in banking, and we've just got a lot of catching up to do. But there are great rewards.
Cassandra, could I just add one other thing to that? Because I think those points have been really important, but there's another danger with technology, which is all too often found, and that's when administration and management believe they've got a technological solution that's just perfect for everybody. And it's often done on the promise of leaving, you're now free to choose. You're empowered to do this or that. What that new technology or software does, it doesn't empower, it loads up workforce with more tasks to do. So instead of being able to spend time in the core care relationship, what should have been an administrative task takes the time of the people at the front line. And we must guard against that very, very carefully, because the key to this productivity revolution isn't that way. It's about enabling and upskilling workforce so that relationship between the caregiver and care receiver is enhanced. And just one final point about this, which is so important to me, we must remember the complexity of the relationship and the decisions and the judgments that need to be made by that workforce. It's incredibly complex. It's incredibly skillful. We tend to downplay that. We quite quickly with people with technology, oh, that's skillful. How good are you? And we forget the most basic bits of this are incredibly skillful and impressive.
Right. Well, looks like there are some really impressive opportunities out there. I'm going to stay on the topic of workforce, and by far our number one question voted on Pigeonhole today is around workforce. And Bronwyn, I'll start with you on this and talking about, you talked about you've got a lot of workers but in quite narrow roles. How do we kind of make it so there is more of that movement between different sectors of the care economy? And then also, how do we build the caring workforce as a whole? So we often hear, oh, we'll get a bit of a pay rise for aged care workers, we'll get a bit of disability, and we see that kind of poaching between sectors, which is not really going to solve the overall problem. What we need to do is grow that pool of caring workforces. So what are some of the solutions out there in order for us to get a better functioning and bigger workforce?
Well, we certainly need a bigger workforce. Our current vacancy rate is 7.7%. It's actually gone down. That's gone down a bit. It was actually higher. And the time and effort and money that is spent in recruiting it would be much better spent in additional care, because our demand is absolutely huge. But it really is, I guess, identifying the common threads that are there in a number of these different sectors, and providing educational opportunities for people to have sort of more foundational skills that are much more transferable. The other thing that's really important is the speed to which we can get people into the workforce. Now, David's right, the judgments and the complexity often that people need to make require a level of sophistication. But, the whole earn and learn model, I think, really does need to be revisited in this space. So, because so much just comes from the experience that you have in the human interactions, and learning about your clients and your consumers, if we spend too much time in a kind of more academic pursuit and don't combine these things, then I think we're missing out. And we're also missing because people just can't afford, if I think about some of the work areas that are quite low paid, people just can't afford to stop working, go off and do some big course, then go through some massive recruitment process. In the meantime, they've lost income, and they'll fill the income with other kinds of roles, maybe in retail or in hospitality. So, we've actually got to be much more sensitive about people's individual circumstances and not wait just for them to come to us. We have to reach in.
And Irene, are we seeing any particular issues with workforce in kind of rural and regional areas as well? Do we need specific strategies in those areas that are a little bit different than maybe we do in cities?
Yeah, sure. So I might start with adding to what Bronwyn was saying, is that, we are experiencing demographic shift at the moment. So I know we talk a lot about, having an aging population, having a population with multimorbidity. But, we also need to remember that, we also have an aging workforce. So I think that, the questions that, we need to consider now is that, how we can actually engage them. There are some, stories, experience about, people having, to try to find another job between 65 to 67 years of age, for example, and also about, the impact of the pensions. So I think there needs to be a better system, to help, to encourage people, older people or people from, with the life experience, for example, to enable them to be part of the workforce. In terms of rural and remote area, obviously, we see a lot about chronic workforce shortage. Most recently, we see a lot of the aged care facilities, for example, closing down. That's partly due to the lower demand because, people want to live in the community. And also, we see, the chronic workforce shortage. So what I think, we're seeing at the moment is that, we do need to change the models of how we operate the care economy so that it can actually fit for purpose not only in terms of, what the people want, so what the consumers want, but also in terms of fitting in with the workforce of the future. So some of the areas that, we can, explore is around, delivering virtual care. So a better system, a better way to integrate care. One of the other solutions that has been proposed, for example, in Tasmania is around like a midwifery group practice. So there are ways that, we can deliver care better, even without the use of technology. So it's not only, the technology that can improve, the care economy, but also the way we actually reorganize the care and also how we can re-engage with the workforce better.
Cassandra, just to take up an issue that Irene's raised there, she's been doing some terrific research in a little country town called Heathcote, a really beautiful town in Victoria, and around dementia and innovations in dementia care provision, involving the development of new community-based measures that offer a degree of dignity and support that we haven't seen before. They're just going through a second iteration. I think, Irene, it might be worthwhile just speaking to that, because it's a really interesting example where you get a combination of innovation, a whole new approach to care that can actually deliver an industry development strategy for an important town. So would you like to talk about that, Irene?
Thanks, David. So in the rural and remote community, obviously, it's important, to engage with the whole of community to make, the care delivery to be sustainable. So an example that David mentioned, was actually published in the Bendigo Advertiser this morning. Is an exciting opportunity, not only for us as a researcher, to engage, to collaborate with the community, but also for the community to actually do research, in collaboration with the technology company. So we have IntelliCare, Heathcote Health, and Heathcote Dementia Alliance together with the Care Villas Australia to actually see whether, to trial this proof of concept, if you like, about independent assistive living. So if you can imagine about, a place that, people can live in the community, so aging in place, but also equipped with the latest technology, the sensors, the monitors, that can help them, support them to be independent and also be connected with the community. So that's what this project is about.
In a rural setting, that's what. So, Bronwyn, it's like you've got some fantastic stuff that your organisation does. No, I was lucky enough to go and meet some of your colleagues, not that you knew it, but in Ballarat doing the social housing provision, and I was just mightily impressed with what they're able to do locally, and then helping to generate a local identity and then an economic current that has lasting benefit.
Yeah, that's right.
I'll stick a little bit on this theme as well. We've got some more questions coming in. And in terms of, expanding this workforce, one of the key issues often is the image of working in care. It's not seen as a particularly glamorous or necessarily high status industry. But what we actually hear often when we talk to workers or you see job satisfaction surveys is that people love working in care. They get a lot of satisfaction from it. It's a very rewarding job. How do we shift the dial on what the image of working in care is like and what it actually is like, which is that most workers are really very happy and satisfied? Bronwyn, I might start with you there.
Well, I do think reward and remuneration is critical. It is part of saying to people that the work that you do is extremely valuable to us as a community. But I think also the capacity for people to kind of grow in their career and to have diversity of experiences. So, when I look at I talked about all of the different disciplines, 15 to 20 different professional groups. So many of those groups are working with pretty much the same client. It just depends a bit on the day of the week. And they have so many sort of common attributes, if you like. But once they kind of get locked into a stream, they can only progress in that stream. And that's not necessarily very satisfying from a career perspective. So we do have to, it is about the way that we organise the systems and then allow the workforce to have that kind of flexibility to grow and develop. But I mean, the classic example is childcare, where, you know, every piece of research that you ever pick up talks about the absolute critical role that childcare and early learning plays in the development of human beings, and how poor experiences in early childhood basically have lifetime consequences. And hello, like, nobody has to be a genius to work that out. But, you know, we continue to consider our childcare workforce, you know, one of the most undervalued and poorly paid workforces in the country. And yet we're giving over our most precious resource, our human beings, to that workforce. So we need a lot of advocacy in this space.
They're interesting too, aren't they, the early childhood educators, because they've got a very strong sense of professional identity.
Absolutely.
And if you look across the care workforce, that varies a lot. So it's not so present in aged care, not so present in disability, pretty strong in social housing, pretty strong in mental health. But the qualifications that are on offer actively discourage a sense of professional identity and purpose. And I think, to come back to your point, Cassandra, that's one of the goals of education training reform, to develop a sense of professional identity, to understand the history of where they've come from and why they're there, be proud about what they're doing so that they can be advocates. Too much of the emphasis on qualifications right now is to do with compliance, that terrible word compliance, and it's boring. No, people don't like it. It's boring. They're looking for other bits of recognition.
Right. Look, I'm going to change tack a little bit now. So we're talking about, we want more workers, we want better quality care, we want technology, we want innovation. I'm an economist, and I'll think, that's going to cost us money. So I think everyone wants this better quality of care, but it is going to be very expensive, particularly when we do see demographic changes, which are meaning more people are going to be requiring care, and probably less taxpayers around to fund it. So what do we need to do to make sure that proper high quality care is well funded and sustainably funded? Is there a more role for private contributions potentially as well for people that can afford it? David, I might start with you.
Look, you know what? I reckon right now it's a wonderful opportunity, because right now the government or the Reserve Bank is trying to slow the economy because they see too much inflation. The other way you can slow the economy is by increasing taxes, and the standout is the Medicare levy. There's no reason why you couldn't increase the Medicare levy and channel it into a care fund to help pay for these kind of innovations. You know what the research shows? People tend not to be so happy about paying more taxes if it goes into just the general ledger. If people know it's going to healthcare, aged care, business, whatever it might be, yeah, I'll pay for that. That's all right. And I think we need to do a little bit more of that, to be thinking about making this a sustainable enterprise. But it can't be money alone, right? We need to do other things, because there's that productivity equation that needs to be fixed too. But I think if we think of it as investment that's going to give a return, so we need to so that we can have less regulation, and we can have fewer people in institutionalised settings where it's not needed, and we can have people leading better, more dignified lives, and there's more people working in the sector being able to contribute economically. Aren't we all better off? So I think we can do it, but I think we've got to have an imagination to enable us to do it. And just one final point, we don't seem to have any trouble in coming up with billions of dollars for new submarines. And the amount of money we're putting into submarines is staggering. The amount of money we're putting into care is not so impressive.
Yes, I think very important about reframing that this is, that social infrastructure and investment opportunities. Yeah, Irene, have you got anything to add there?
I think I agree with what David was saying. You know, it's important that, you know, we see this as an investment. And in terms of, you know, the current state of play at the moment, there's a lot of duplication, I mean, that Bronwyn mentioned, you know. So there's a lot of opportunity there, you know, for us, you know, for researchers, you know, for industry partners to actually come together and look at, you know, how we can actually reduce the duplication, reduce the admin wastage, reduce the new technology adoption wastage, because people don't, you know, you develop the technology and no one is taking it up. So even if we can, start on that, we can make a huge impact further down the line. So it's not a too hard basket action to do. We need to start somewhere. And I think, the action really is, in front of us here to address.
I think there's an enormous amount of productivity to be gained as well. And David's right, we do need to prioritise resources into the care economy, because if we have an unhealthy workforce, or a workforce or a community, we have an unhealthy community, we have a community that's diminished in itself in its own productivity. So there's that kind of economic incentive, and there's some very important work that's been done on the value of dealing with things like mental health and others, because when the community is unwell, it's not productive. So that's an economic argument in itself. But, I'll just give you a couple of quick examples. How many of us have been to a GP with a problem, and the GP says, look, I really need to send you to a specialist, and you'll probably need, a scan or something like that. So then they send you off to the specialist, and the specialist says, yeah, you need a scan. Well, and then you need another appointment for me to check the scan. And that's just the beginning of the journey. So how much easier would it have been if the records were lined up and you had the scan before you went to the specialist? You only had one appointment instead of two. We've all had that experience. But, I talk about recidivism. We have youth drug and alcohol withdrawal programs, but because they're standalone programs and don't necessarily have sort of step down and ongoing support with housing and employment and all of those things, we have a 70% recidivism rate in one of our youth alcohol and drug withdrawal units. It's not because the people there aren't working incredibly hard. It's just that there's nowhere, this is in a rural area, there's nowhere for them to go when they come out. And so, it's not rocket science. They immediately go back into the same environment that they've been in previously. And all of that really costly 24-hour care, psychologists, drug and alcohol specialists, etc., all of that work they put in, it's good work, but gee, it could be a whole lot better if it was followed up with ongoing case management and support in all of those other areas. So they're productivity things that we can do right now if we were better lined up.
So we've talked a lot today about this need for better connectiveness and collaboration, and this view of the care economy as kind of one big sector. How do we get that through to governments and policymakers and actually see that starting to happen, where we often have very dispersed areas of responsibility, which is probably leading to some of these issues? What can we do to encourage governments to see it as one sector and to get some of those connected strings kind of much more together? David?
That's the importance of that term, care economy. And Irene and I have talked about being delighted to see that term being used more by governments at all levels. So instead of talking about silos, they've suddenly seen this little opportunity through a care economy because they have a shared interest in seeing those silos broken down so that those systematic problems can be dealt with in a much more effective way than possible. Just one point I was going to raise in relation to your previous question, Cassandra, which was about financing and funding. There is one bit of this equation that is a curious one, and that's the NDIS. NDIS funding is going to go from something like 11 billion back in 2010 to 60 billion by 2030. And it is growing like topsy. There's no controls, nothing. Now, at the same time, there are workforce shortages everywhere. That the money is pouring in, but at the front end of it, it's not ending up where it should do, as governments have come to rely on just markets to solve problems. They don't work very well, markets left to themselves. And that's probably a model that we need to look at urgently because so much is going into it. And I'm not sure it involves as effective a spend as it should do.
Absolutely, and I think we see a lot of those issues with the, what's in an NDIS bucket of funding versus what might be aged care or other areas of funding. It makes things very complicated.
Yeah, and look, I alluded to this in my opening comments, and I kind of feel like I should be ducking now, having had some of these responsibilities in the past. But I think sometimes a crisis emerges in a community. There's a series of deaths in an aged care facility, or problems with disability services, and so, or in family violence, there's a public explosion or concern, and so the natural reaction in more recent times is to call for a royal commission. And I don't always think we get the best outcomes, and they're very costly. And the Aged Care Royal Commission is a great case in point, where very few of the recommendations have actually been implemented. This is the work of public servants in partnership with the sector to, build the reform agenda that is not crisis driven. When I was Community Services Minister, if there was a tragic child death, and that happens all the time, the first thing everybody says is put on more child protection workers. Well, that's not going to solve anything. We've just put on more and more and more and more for years and years and years and years, and we haven't. In fact, the number of kids in out-of-home care is escalating beyond the capacity of government to pay for that enormous cost. We do need substantial reform, and we need that to be led by government, and not that, there's a crisis, let's have an inquiry, and then let's put another whole layer of programs on top of the existing ones, which just causes more complexity, more compliance, and doesn't necessarily take us any further in really getting to the heart of a lot of the issues. And I'll put in another plug here. Poverty is at the heart of many of the challenges that we face in the human services sector, and putting band-aids on people's problems when they're fundamentally incredibly poor is very short-sighted public policy.
Thanks, Bronwyn. David.
There is another answer to that question about what can we do to get people, that we need a care economy cooperative research centre, which is what we're putting forward to the federal government very shortly.
Yeah, thank you. So, Irene, you're doing some fantastic work in really trying to achieve this and put this forward. Do you want to, I know you talked a little bit about it in the intro, but do you want to talk a little bit more about kind of how can everyone on this call and listening in maybe get on board and help with really pushing this care economy collaborative research centre and pushing the care economy as a real policy area?
Yeah, thanks, Cassandra. So as we talk about, this is not just only the government issues. Obviously, it's great that the government is taking this seriously and, trying to, provide, the leadership, at high level. But, as David mentioned, the market is not just about the government, what the government funding put into, but industry, the private industries, the consumers, can also play a role in this. So the CRC obviously is an excellent, opportunity for us all, to look at the innovation over a 10-year period. Some of the problems that we found is, when the money is being thrown, to actually solve some of the issues, it's usually short term. And, with, such a complex issues like care economy, we do need to have a longer term solution. And this is where, Research Institute is there. But I think, the care economy CRC is really a good vehicle, for the government to actually support the innovation that comes, not only from the private sort of industry sectors, but work together with them and the consumers, big bodies and regulators to bring everyone on board and essentially, build the capacity across the board.
Fantastic. Well, on that note, we are out of time, so it's gone very quickly. But I think we've touched on some really important topics here. So I hope everyone will take away that we do need to be talking about the care economy as an overall sector and as social and economic infrastructure, not just kind of drains on budget. But we touched on some really interesting points around the role of technology and innovation, improving productivity, and expanding the workforce and solving some of these funding challenges. So thank you so much to our panelists today, David, Bronwyn and Irene. We really appreciate your expert insights and taking the time. And thank you also to our audience for your active participation. We got a lot of questions through on Pigeonhole. I'm sorry we didn't quite get to all of them, but I think we got to the top voted ones, so that's fantastic. And of course, a huge thanks to our sponsor of today's live stream, La Trobe University, for making this possible. While you're still on Pigeonhole, please do take a moment and give some feedback and rank today's discussion. I should also remind you that the discussion today has been recorded and you will receive a link to the recording soon, which you can then share around to any of your colleagues that couldn't join in today. Please also stay in touch via the CEDA website, so ceda.com.au. You can register for upcoming events there. Our next live stream is on Tuesday, the 7th of March, which is the ACCC's annual enforcement and compliance policy update. We also have a number of in-person events in all states and territories that you can find out about there. And you can also check out CEDA Learning, which is our new products with online and face-to-face learning around economics, public policy and ESG. So thank you again, everyone, for joining in today, and huge thanks to our speakers. That's it. Thank you.